Let's take you to the continent now. Kenyan public hospital doctors have rejected a government wage offer. A strike there has so far disrupted health services across the country. The doctors' unions are demanding payment of their salaries in arrears and the hiring of trainee doctors. Let's bring in Felix Ouko, who is with the Kenya Union of Clinical Officers. Felix, it's great to talk to you. Thanks very much indeed for coming on to the program. So my understanding is that on Tuesday the government asked doctors to end the strike. They said the arrears would be paid and that trainee doctors would be hired as of Thursday, as of yesterday. Was that the offer that was rejected?
That offer was, thank you very much. I'm Felix Ouko. That offer was rejected by our union, and we are looking forward for the government to give a better offer so that we can end the strike.
And what does a better offer look like, Felix?
The better offer is looking at the 19 grievances that the doctors brought across. Number one is about posting of interns. And if you look at what the government is offering in terms of interns, it is 91% reduction of their remuneration. Our doctors normally receive a remuneration of 206,000 per month, and if you see what the government wants to offer is a reduction up to 70,000, and that is totally unacceptable. It is way below what is recommended, and as a union, we are not going to take that. Other issues that we want to talk about is about the promotions. We have our members who have stagnated in one job group for a longer period of time. And because of this, if you can remember, health in Nairobi or in Kenya is devolved. So each and every county can decide and promote people on different scale. But we want all the doctors in the country to be promoted. Another issue that we want to talk about is about comprehensive cover. As you know, if you don't have a comprehensive cover as a doctor, then it means when you are sick, then you cannot get the care or the services that you provide in the same hospital. Initially, we had a national insurance policy that catered for this. However, in the new change of insurance policy from national health insurance to social health authority, this has been reduced or has been removed from the initial package that the doctors normally get. So in the new authority or the new social health fund, the comprehensive cover is not there. Another thing that we want to talk about is payment of fee for the postgraduate doctors. The doctors who normally go for the postgraduate training are supposed to be sponsored or supposed to get scholarship from the government. We have a number of people who haven't, their fees haven't been paid up to now. So in one of the counties that we have above, we call it Kirinyaga County, all the healthcare workers were removed from payroll or from service. Now it is more than 4 years up to now when they have not been working, and it is it is inhuman, and we are asking the government, if possible, these people should be reinstated so that we can go back to work and give services to our people.
Yeah, just some context there. 1 South African rand equaling almost 7 Kenyan shilling for our viewers who are trying to work out the amounts that you've just mentioned, Felix. So are you back around the negotiating table? Are there plans to get back around the table?
The plans are there. We have seen the goodwill, but we have also seen a lot of chest thumping from some sectors of the government, and we are asking them to come back. If a good counter offer is provided, then the doctors, the clinical officers, and even the laboratory technicians will go back to work. Currently, to put you on speed, we have the doctors, that is the medical officers who are on strike, and we also have the clinical officers who are on strike. So both of them are agitating for the same, that they want to be addressed so that they can also get.
All right, it appears we've lost our connection there to Felix Ouko. I'm going to try and give it a few seconds to see if it will stabilize. All right, it hasn't. But he says there are plans to get back around the negotiating table for those grievances that he outlined. I didn't get to the part where we could talk about the impact of this strike on healthcare services in Kenya. A number of stories here being told about people being turned away, people in dire need of emergency and scheduled serious surgeries having been turned away, and trying to find healthcare at neighboring countries.